I'm really happy with the policy because they didn't offer one, and if it wasn't cheap, I wouldn't have health insurance right now.
That was the idea behind Stony Brook University's push to implement a mandatory health insurance policy. For the past 5 years, Stony Brook University has required all full-time students to have a health insurance plan. Students not covered under a health insurance plan must purchase the university's plan for as long as they're enrolled. Former Stony Brook president Dr. Kenny, who was only available to speak by phone, said she believes the policy is important.
The university says everybody must have coverage. A lot of young people think, they're young, they're healthy, they don't need it. You absolutely have to have it, given the cost of medical care in this country. If you don't have other coverage, we can provide for you an inexpensive solution.
Of the roughly 23,000 students at Stony Brook, 20% of the campus is covered under this policy. While some students argue the policy is unnecessary, others are supportive.
If I wasn't mandated to have Stony Brook health insurance, I wouldn't have health insurance myself. It's one of those things where you don't feel it's absolutely necessary, but then once you realize you don't have it, you're kind of screwed when you need it.
For example, take Naveen, who while riding to class fell off his bike. He says without insurance, he'd be in worse shape.
One mishap and you could be in a lot of financial trouble without it.
Originally, Stony Brook offered an optional plan starting in 2000 when the university realized a growing number of students were uninsured.
What was happening was that at least a third of the students here had no insurance whatsoever. They didn't have insurance through their parents. They weren't working, so they had no insurance through that. And they weren't eligible for something like Medicaid.
The plan, which is $1,030 a year, is designed to protect the university from increasing dropout rates due to expensive medical bills while providing students with affordable health insurance.
This actually, you can see the result of it when you need it, though. That's the nice part, is that you could be paying, let's say, $1,000 a year for insurance, but wind up with a $20,000 bill.
Stony Brook's health insurance plan, which is with Aetna, goes out for bid in January. While the school is unsure who their future health care provider may be, they expect the policy to be similar. For Stony Brook Now, I'm Billy Lind.